let's look at some interpretation of X-rays. All right, how do we interpret that? Before that, this is the most important concept that we need to understand. Different tissue types absorb X-rays to varying degrees, right? So there are low densities of tissue and also high density tissue. So what will happen, or what does it appear on X-rays? So air will be the darkest, blackest, or what we call as lucent. Then fat will be slightly visible, grayish. Soft tissue much more brighter, bone much more brighter, and metal the brightest. So by having this concept, then we know, for example, in lung parenchyma, you should have an air, then it should be black. If you notice something other than black, so it means something wrong. Is that something wrong in the lung parenchyma, and so forth. Having said that, we need to have some system on how we interpret the X-rays. There are few systems given by many speakers there. So you can have inside-out system. So go from central to peripheral, from heart, check for heart border, enlargement of the heart, mediastinum, look for the mediastinum widening. Is there any mass in the mediastinum? Lung parenchyma, and go slightly more peripheral. Don't forget the bones, don't forget the soft tissue, and finally don't forget the abdomen. Sometimes the chest X-ray, when it includes some part of the abdomen, you can also see the dilated small bowel. So that's actually the clue is there. So some people are using this system. So me myself also use this system, but some other develop a system as simple as A, B, C, D, E. So go for airway, look for the trachea and bronchus. B, look for breathing, lung and pleura. How is the lung and pleura? Circulation, they look for heart, aorta, pulmonary vessel. Disability, look for the bone, soft tissue, any fracture or any mass in the soft tissue. And else means foreign body, tubes, and also abdomen. All right. Another thing that we must not forget is what we call as review areas. All right. This is very important. What are the review areas? These are the review areas that we need to look. So lung epiphysis, hilar, retrocardiac, and also diaphragm. I will show you some example. All right. So let's look at the example of the review areas. Okay. So from this X-ray, is there any abnormalities that can be seen from this X-ray? Okay. So on a glance, at a glance, probably someone will say, "Oh, actually normal," But remember the review areas. Okay. So this patient had a CT later. Okay. You look at this mass at the left, right lower lobe, right lower zone, and that's actually correspond to this area. Okay. So it's very opaque here. So as I said, it should be black, but something white is here. So if we don't really scrutinize our review area, we can miss this. Okay. Another thing that we have to keep in our mind is actually variance. All right, variance. So these are the commonest variant that you might encounter. So this is not pneumothorax or not a mass or anything. This is what we call as a azygous lobe. All right. So there is an interference between the azygous vein and also the right upper lobe. So this is what we call as azygous lobe. So this is actually absolutely normal. Okay. So some patient will have a calcified ribs or calcified cartilage. All right. So those are the variants that we need to remember. Okay. So some bonus. So is it normal? Is it abnormal? The arrow there. You can see the right heart border is actually cannot be, not really clear, not really sharp, the right heart border. Okay. So if we don't really scrutinize or look into the detail of this image, probably we will say this is some pathology. Okay. So how we want to confirm this, we can also do a lateral X-rays. Okay. So you can see that this is the inward shape of the thorax cavity. So this is a pectus excavatum. Okay. So how to differentiate the pectus excavatum as compared to the probably pathology here at this region. So pectus excavatum, as you know, is a congenital defect. So when there is an inward of the thoracic cavity, so you look at the ribs, you notice that the ribs is much more horizontal. Okay, if I may, okay, keep in mind these ribs. Okay, the ribs horizontal and the posterior ribs more vertical. It's like a 7 inverted 7, right? Okay, let's look at the previous X-ray. Notice that the ribs are much more angulated and not that vertical as compared to the previous one. Okay, so this is more horizontal, straight, flattened. So this is a horizontal posterior rib, where the anterior rib is a vertical. So this is actually a pectus excavatum and it's a normal variant.